Kathleen Martinez is a physician assistant at Bronson Orthopedic and Joint Specialists in South Haven. Kathleen works directly with Dr. Mark Nickel, a fellowship-trained and board-certified sports medicine surgeon, providing orthopedic care for individuals in and around South Haven. We're speaking to Kathleen Martinez today about rotator cuff injuries and the treatment available. Kathleen, what is a rotator cuff injury, and how does somebody become injured? Is it job-related, sports, age?
A rotator cuff injury is an injury to a group of four muscles within the shoulder. These muscles are the supraspinatus, infraspinatus, subscapularis, and teres minor. The job of these muscles, or the rotator cuff, is to help you move the shoulder as well as keep the shoulder joint together. They can become injured either traumatically, typically from a fall, or chronically over time with repetitive type movements of the shoulder, either due to your job or sports or age.
What are symptoms of a rotator cuff injury, and when should someone see a doctor?
Symptoms of a rotator cuff tear or injury include pain and weakness of the affected shoulder. I recommend seeing an orthopedic provider as soon as your symptoms begin because rotator cuff injuries have better outcomes when they're treated immediately.
How do you diagnose a rotator cuff injury?
Rotator cuff injuries can be diagnosed with a physical exam of the shoulder. Typically, patients will lack a range of motion and have weakness of the shoulder. If I'm concerned about a rotator cuff tear, I typically order what's called an MRI to confirm the diagnosis.
Talk about some treatment options for a rotator cuff injury, non-surgical options and surgical.
Smaller, less symptomatic tears can be treated with cortisone injections of the shoulder, medications such as Tylenol and Motrin, and physical therapy. Larger tears typically require arthroscopic repair or surgery. When deciding to pursue surgery, we take into account multiple different things, which include the amount of arthritis within the shoulder, as well as the patient's age.
When surgical intervention is needed, what sort of patient education and preparedness is offered?
To prepare patients for surgery, we discuss the typical recovery time and the physical therapy protocol that takes place after surgery. Typical recovery time is around 6 months. Patients are placed in a sling for 6 weeks after surgery. For the first month after surgery, physical therapy focuses on passive range of motion. This is when the therapists help you move the arm. During the second month, we recommend active assist range of motion, which is when we use things such as pulleys to help you move your arm. And then the third month is when you're able to actively move your arm on your own. During month 4 is when you start lifting light weights and building strength. It takes up to 4 months for that rotator cuff to heal back down to the bone where it's supposed to be. And if patients lift too heavy or move their shoulder too soon, you risk damaging that repair.
So, Kathleen, how would someone contact the practice about questions or to schedule an appointment?
You can call us at 855-618-2676 to schedule an appointment. We do offer same-day appointments dependent on the provider availability as well as the schedule.
And where can we get more information?
You can visit bronsonhealth.com/ortho for more information about orthopedic care within Bronson.
Thanks, Kathleen. Kathleen Martinez, physician assistant at Bronson Orthopedic and Joint Specialists in South Haven. Kathleen works directly with Dr. Mark Nickel, a fellowship-trained and board-certified sports medicine surgeon, providing orthopedic care for individuals in and around South Haven.